We're honored to have Dr. Nassar come to Delafield once again. This is the third time we've been blessed with his presence. For those of you who are unfamiliar with his credentials, I'd like to just give you a little bit of information about him. He has degrees in internal medicine, cardiology, nuclear cardiology, biochemistry, agronomy, and nutrition. He has a full practice in Lake Villa, Illinois, and he deals in preventative medicine. This evening, he's going to be talking about the autoimmune diseases and topics such as cancer, allergies, Alzheimer's disease, AIDS, arthritis, multiple sclerosis. They're all under this category. There'll be time at the end to have questions, so if you do have them, write them down while he gives a lecture. There will be audio tapes and videotapes available, and if you have questions about them, please see Bill Schultz or myself after the lecture. Before I introduce you, Dr. Nassar, I would just like to personally thank you again for being here.
Thank you for having me here.
You're a very unique person, and it's unusual to have a physician take time out of his practice to educate people about how to prevent disease or how to reverse the diseases that they have. And I personally feel you've given my life a lot of optimism and encouragement, and I hope to pass that on to as many people through these meetings as I can.
I hope so.
So will you all help me welcome Dr. Nassar.
Good evening. When Sharon asked me about 2 months or 3 months ago, what topic I would like to speak about, and I'm supposed to be talking about arthritis or diabetes or something like that, I told her I think for the first time I like to talk to the people, a general public, about autoimmune disease, because nobody have done anything yet in this country, the role of nutrition in autoimmune disease, which is tremendous. And lots of you don't know what the word autoimmune disease means, right? Okay, we will go over that, but before we get to that, let us understand a few things about our health in this country. If you look at the status of health in the most advanced country in the world, United States of America, who got almost everything, you find something very disturbing happening in the same time with the technology we have. What is happening, if you watch what has been going on from the year 1900 until now, you find between the year 1800 to the year 1900, it's almost unheard of to hear about cancer, Alzheimer's disease, multiple sclerosis, cancer, sometimes even heart attacks and things like that. And there was no statistics that time really. However, if one goes back to study what people died from those days, you find that fell under a tractor, got hit by a cow, got infection, but not too many people were suffering from these incurable diseases we have these days. Doctors tell the patient, well, cancer always has been with us since Adam and Eve, and it never went up. It's still the same, which was nothing but a lie. For years they lied about that, because cancer, we have said, if you heard my lectures 15 years ago, I don't know if any of you have ever heard any tapes I have when I started, I'm sure some here have. I only suspected, I wasn't sure, but I suspected all these chemicals coming in the air and the water by millions of tons every day in the air and our water eventually is going to do something to us. And when we look at the diseases that start happening to us, we find cancer is in the rise all the time. Even with over $2 billion of research, right now, it's a deadlock. We have succeeded of finding radiation to hold it down. We have succeeded finding chemotherapy to hold it down. We have succeeded to do surgery to get it out, but it still comes back again, so cancer is still incurable. We are talking in general. There are certain types of cancer we have succeeded quite a bit with, like lymphomas and the lymph gland type of cancer. But cancer is in the rise all the time, and if you go back just 25 years ago, 1960, about 200,000 people died from cancer. 1986, we expect 700,000 people to die from cancer. 700,000 in 1 year. And that keep going on and on. There is nothing more depressing to me than to examine a patient and find out that he have a cancer and it's too late. And that is because the patient usually comes in looking good, feeling good, that I want a physical, and here we are, we find a tumor in the liver, we pray it's only in the liver, and we find it in the lung, we find it in the bone, and here we're going to tell a person who's feeling good. No pain, nothing at all. So this type of diseases not only destroys the person's life and the quality of life, it destroys also the family in the same time. Another disease on the rise all the time right now, as you already know yourself, is heart disease. Heart disease is keep increasing, and 1960 there were about 250,000 people died from heart disease. By 1986, 1.5 million people will have a heart attack, and the majority of them will die. This is just two diseases. We have not even touched other groups of disease like diabetes and arthritis, drugs, accidents, all of these other things. When we look at these statistics, we find also that diabetes going the same way, hypoglycemia going in the same route, arthritis going in the same route, depression going in the same route, and all the diseases just keep multiplying, increasing. It is true that we're living longer nowadays compared to 30 years ago. The reason we are living longer is not because we are healthier. Remember that. We are living longer because there are so many drugs keeping people in agony alive. It is the quality of life what it counts, not how many years you are alive. If you are 30 years of age and you're suffering every day on respirator, I rather see that person dead than being in that condition. It is not a quality of life to see somebody who have a stroke laying in a nursing home with the stool coming from his butt all over the bed. He cannot clean himself. He cannot feed himself. And that person used to be independent person, proud of himself, supported the family, raised the kids, did a job, helped the country, and all of a sudden, what he's doing, he is the only one who's suffering. Nobody suffers except the person himself. You can have a wife with you for 50 years, but you the only sufferer. She will come and visit you the first, or a husband, the first time every day in the hospital. It comes to be once a week, and then once a month, and then after that, he or she will find somebody else, and you're still the only one who suffers. The kids will come and visit you frequently. After that, it goes down and down, and you're the only one left alone. So health, when it goes, it does not come back. After all, when we go, we don't take the Cadillacs and the luxury homes and the 2,000 pairs of shoes and all of these things with us. We only, just to take consider yourself that you got to start analyzing your health much more careful than you have done in the past. The problem we see also that many people has been taught that if you feel good, you don't have a problem. You got to remember that once you start feel bad, that might be too late. because whatever disease is going to develop, it is in the end stage. So you don't have to wait until you start having the symptoms. Out of the patients I see, 90% of the patients we see have no complaints at all. They come and they want just a physical examination. Out of those people who have absolutely no symptoms, we find 10% have sudden death syndrome. Means they could have dropped dead anytime they didn't know it. And some of them have cancer, some have arthritis, some have ulcers, kidney problem, and many other problems. The role of preventive medicine is, number one, is to try to find these diseases in early stage. I have not seen a disease yet discovered early is not curable. Every disease, including cancer, we just have discovered early is curable. And we have not lost one single patient in 5 years, except the one who came in terminal cases of cancer or heart problems, and it was too late for us to do anything. We tried, but we failed. When you look at this statistics right here, it becomes very disturbing. When you look at this here and try to apply to your friends, to the general life you're living in, you find out there are people at 30 years of age who are developing cancer. There are people who are 10 years of age developing diabetes. There are children who are developing ulcers. There are children who develop rheumatoid arthritis. There are young women and men developing multiple sclerosis at the age of 18 and 20. There are people at the age of 50, they cannot even remember what they have eaten yesterday. All of this, it tells us something, that the medical field is going in the wrong direction. Number one, they should pay lots of emphasis on prevention, which they not. They should pay lots of emphasis on early diagnosis. How many of you, if you have a heart test and you had no complaint, the insurance would refuse to pay for it because you were not sick? How many of you had a cancer test and then the insurance, you didn't have a cancer, and the insurance company said, no, because you didn't have a cancer, then we're not going to pay for it? The philosophy of medicine in America, wait until you get sick, then do something about it. And that is really too late. It is way, way too late. If we adopt a policy that try to find everything early enough, I think we can cure every disease. But the insurance company and those people, they don't look at it that way. Their philosophy is this, especially Medicare. If we don't check anybody for heart problem or cancer, the one who have it going to die, the one they don't have is going to survive. This way they can get rid of the higher risk group and they still making profit. And this is actually the fact. I have patients at the age of 64, before they go on Medicare, their insurance company does everything for them. The moment they go on Medicare, the poor thing cannot even have a simple blood test. He's not allowed even to have a blood test. And they don't tell us why, but I think it is obvious why. Let the senior citizen die, this way they don't have to pay any money, but they don't come out in the open and say it that way. When you look at this statistic, one thing one has to wonder, what is happening to us? I did that, and I find some of the answers to the problem. I find out also that when we look between these years, 1800 until now, or 1900 until now, we find the amount of chemicals in our food has gone up. Between the year 1960, we had about 20 chemicals added to the food. 1986, 15,000. Can this be responsible for this? I said yes, you might say yes, but they say no. They say these chemicals we add to the food to kill the germs, it will not kill you if you take a little bit at a time. It will not kill you right away. It will kill you in 20 years. But they don't say that. These chemicals who can kill a bacteria, it will kill a human cell. Are you following me or not? Because a bacteria is a live cell. And a human cell is a live cell. If you kill the bacteria, it's going to kill the human cell. But they don't look at it that way. Besides that, some of these chemicals interact with each other inside the body and create new chemicals. I'm sure you heard all about these things. The amount of chemicals in the water have gone up. The wells, especially, lots of chemicals in the wells right now because all this radiation and chemical from the air, the lead from gasoline, from automobiles, from leaded pipes, and the radiation all goes in the ground to underground water, and then we get it out and drink it. The amount of chemicals in the air have gone up from approximately 20 chemicals, right now over 1,500 chemicals in the air. The total number of chemicals in the environment we are exposed to has gone up from 2,000, the total, to 60,000. Can these chemicals be responsible for these diseases? And to let you know, these chemicals, the majority of them, the body cannot get rid of it. Vitamin E and vitamin C and vitamin B cannot get rid of heavy metals and heavy toxicity out of the body. I was very disturbed with another chemical that is going on these days, the radiation chemical, radioactive substances in the air. I'm sure you heard about all this radiation fallout and all of these things. How much that affects us? Because we can remove these chemicals from the body using EDTA or using penicillamine or using medications even. We can remove that. But radiation, we don't know how to remove radiation from the human body. This is why I went ahead about 2 years ago and I started taking courses in nuclear physics to understand what happens if some of those nuclear reactors around got sabotaged by a terrorist or an earthquake or lightning, who knows, from any reason, and blew. What's going to happen? And then I start making my formula to counter that. Thank God I was successful actually of making a formula that allow, if there is a bomb, even atomic bomb, within 60 miles from here, that person can be walking outside with the fallout and nothing will happen to him. But that formula is pretty much toxic to the intestine, but that's the only thing I could have done. I mean, you'll be sick to your stomach and vomiting, but the radiation is not going to have effect on the body. And the federal government adopted that formula already, which consists of vitamin E and potassium perchlorate and potassium iodide, like kelp, in very, very high dosage to saturate the body. And once the body is saturated, the beta and gamma waves do not have anything to hold on, so they go through you and they do not cause any problems. And vitamin E was a very big part of it. These chemicals here are not the only problem. Last lectures, I talked to you about, I'm sure lots of you were here last lecture, about there is another problem I have discovered. The amount of vitamins in the food are going down. Why is that? Do you believe the amount of vitamins in our food going down or not? It has to be going down. It does not take a brain to figure these things, because it's common sense. Vitamins are life, right or wrong? They're life. the word vitamin from Latin means essential to life. It's a life substance. Do you believe then these vitamins gonna stay alive in food if the food is stored for 2 weeks, being processed, being heated, being irradiated, and put in a microwave oven, and all of that? You think that those vitamins are still there or not? Most of it are gone. So there is tremendous decrease on the amount of vitamins, which aggravated by the chemicals in the air. Are you following me, or are you lost yet? Chemicals in the air which intoxicate animals and human beings can also destroy vitamins in our vegetables and fruits. Do you believe that or not? It is true that vitamin C is anti-what? Antioxidant. If you have ozone in the air and carbon monoxide and all of that, do you believe then that the vitamin C in the orange will be destroyed by the smog or not? It will be destroyed. However, the good doctors always say, if you eat right, you don't need to take extra vitamin C. Well, who eats right? Where's the food coming from? It is true, if the food is coming out of the moon and there is no smog there yet, we will find the vitamins. But right now, if this orange is coming from Orange County, the center of smog of the world, or from Florida, which there is quite a bit of pollution over there too, these oranges, by the time they get here, they're absolutely useless. They look yellow, jaundiced, but they're okay. The amount of trace minerals also gone down. What is a trace mineral? Can anybody here give me an example about a trace mineral? Like chromium. Let's take chromium, one trace mineral. Is chromium important to the human body? Yes, it is. When did we find out that chromium is important to the human body? Only a few years ago. For years and years and years, the government says, who needs a chromium? How about cobalt? How about zinc? How about selenium? How about cyanide? Is cyanide a trace mineral or not? You know cyanide is poison, right? But do you believe or not that human body has to have certain amount of cyanide in the food every day? You have to have cyanide every day. Believe it or not. God, the way He created the cyanide He created in earth is not poison. The man-made cyanide is poison. But cyanocobalamin, which is vitamin B12, is not poison to us. So the amount of trace minerals gone down. Can this create disease? Yes, it can create disease. When we look at this here, and we put the smog next to it, we can see very well that the reason that diseases are going up. And the third problem is the amount of stress in our life. Let's use red this time. Oh, used red already. Let's use black. Okay, so it looks good in the video. The amount of stress has gone up like this. Stress is one of the biggest enemies we can have in our life. Stress, most of the time, is self-induced. It's coming from within the body, not from outside. But stress from outside can aggravate pre-existing conditions. You follow me or no? Most of stress is from within. When you have problems inside, when you have malnutrition, when you have problems in your chemistry, your hormones, you don't take tension very well and you get nervous right away. That's your problem. It is not the people who made you mad. But however, listening to the noise pollution, listening to the aggravation and the tension in our life, the worry we have in our life, can bring about diseases that is hidden inside the body. like ulcers. People who are nervous under stress, they develop ulcers. People who under stress, they develop heart attacks and strokes and high blood pressure. So stress, in conjunction with deficiency of nutrients, in conjunction with chemicals, causes these diseases to be on the rise. When I discovered all of that about 15 years ago, and this is why I had to get all these degrees. You know, I had to go to agriculture school, study 4 years, to study the soil and the food. Then I knew the food, good food from bad food. Then we have to go through biochemistry and physiology and nutrition toward the PhD. Then I discovered how this food works inside the body, which food is good, which food is bad, how much nutrients, how much supplements, and all of that. But I didn't know how to prescribe it to people with all this knowledge because I didn't have a medical degree. A medical degree was necessary for me to understand diseases. You know, for high blood pressure, you need certain nutrients. For hormone imbalance, you need different nutrients. For heart attack, you need to avoid certain things. For blood clots, you need to avoid alfalfa, for example. When you have a blood clot, you have to avoid it for 15, 20 days. Then go back on it and increase your vitamin E. So the medical degree was absolutely necessary. That's why I find out that 3 causes of diseases we have in this country. One of them is nutritional problem. We already talked about that. The other are chemical or toxins or poison. And the third one is stress. When we talk about the stress, not only we are talking about the stress I just mentioned, if you don't get enough sleep, you have stress. If you don't rest properly, you have stress. If you do not meditate, you will have stress. So the word stress is very, very vague and very generalized, but in general, people who have a nutritional problem will have more what? Stress. People who are exposed to chemicals will have more stress. And people who have nutritional problem will have more chemicals. People who take lots of chemicals will develop nutritional deficiency. And people under lots of stress, they accumulate lots of chemicals in their system. People under lots of stress, they consume lots of nutrients out of their body. And all of that can cause disease. And disease does not have to have symptoms. Disease can occur in stages like this. Let's suppose this is the first year in life. Let's say this is the 50 year in life, this is 100 year in life. That child, or us, can develop gradual problems in different organs, different diseases, but do not have symptoms yet. And once he develops symptoms, then he goes to the doctor to find out. Many times, so many years pass by. Maybe 20 or 25 years the disease is growing inside the body. So, you think everybody in this country have some kind of a disease according to that or not? We all do. Let me ask you a question. Do you expect to see less disease in people who take good care of their nutritional needs? And I found that in my practice. There is much less disease in people who are taking good care of their health than people who eat junk food. People who consume lots of chemicals, do they have more disease or not? People under lots of stress, do they have more disease or not? So this is not a magic formula I discovered. It's just a common sense formula. I brought it out 15 years ago, and it was met with tremendous attack from medical establishment. Because the original theory was that most of the causes of disease, they say, I write another one down here, infection, genetic, your father gave it to you, and others. They couldn't fill that, so they put syndromes. You know, that's what the word syndrome means. It means we don't know. Infection, it is not a disease. It's a symptom of a disease. It's a result of a disease. Genetic, we don't have to keep blaming our parents for everything we got. If everything's genetic, we shouldn't be here. If everything goes back and back, we all should be dead million years ago. So we cannot really play that emphasis on genes. Besides, we can do nothing about it if it is there. But it is true. A mother and father and a son who are living in the same environment, most likely they're going to develop the same disease. Because they're all under the same conditions. You understand or no? The state of Iowa and Ohio and Michigan, for example, I see lots of cancer from those states. And some parts of Wisconsin. Families who are living in this location, they all have cancer eventually. And I discovered because they have a dump in their area close by that has chemicals that causes cancer. It was not genetic. It was the chemical affected everybody in the family. You follow me or no? And the same thing applies to diabetes and many other diseases. When we look at this picture here then, we can then say, we actually can prevent the diseases. If we take good care of our body nutritionally and avoid chemicals, avoid the stress, we'd be perfect. But it's very easy said, very hardly done. We can't do that. We travel all the time. How many people is going to carry their salads and nice organic tomatoes and everything with them in the car with people traveling all over the country? It's impossible. So the nutritional deficiency develops and food supplementations will be nice to add to the diet when you're traveling them. How about chemicals? You can do nothing about it. It is true you can avoid eating certain food with chemicals, drinking certain drinks with chemicals. How about the chemicals in the air we breathe every day? You can just go with a mask, it will look funny. So we cannot avoid this. Many times we cannot avoid that. When I did this study also, I have found how does these diseases develop inside the human body? How do they develop? And then to understand that, let me draw a diagram or a picture of a human body, different organs, starting with the skull to the skeleton, to the legs, the arm. This skeleton in front of you made of bones, and the bones made of millions of cells. And disease of the bone develops inside those cells. And the bone cell, to make nice bone and make blood for us and improve the immune system, they require what? Food. What kind of food they need? They need protein, carbohydrate, and fat, vitamins, water, mineral, and oxygen. You follow me or no? Any deficiency of single one of these can cause a disaster. And we're talking about the oxygen is an individual unit. Water is an individual unit. Protein is an individual unit. Carbohydrate is an individual unit. And fat also is an individual unit. But when we talk about vitamins and minerals, we are talking about multi-units. Thousands of things you have to take. 35 trace minerals and about 33 vitamins. All you have to have deficiency of one single trace minerals or one single vitamin. This food right here also goes in all kinds of cells inside the body. It comes from the mouth to the tank you have in the middle of the right here called the stomach, and gets digested, then it gets absorbed, and then it goes to the liver, and from the liver it goes to the heart, and from the heart the blood goes with the nutrients to the rest of the body. You following that or not? I did it very fast because we have covered it in detail in many other lectures. This route right here, if you don't have any deficiency, which I doubt it very much, in your food, and this food goes inside the stomach, and the stomach does not digest that food properly, those supplements will go in and out, and they will not enter the bloodstream. You have to have certain pH, you have to have certain enzymes, and you have to have intestine that's healthy. Healthy intestine is very important to absorb food. How many people do I see have healthy intestine? Very few. If you don't have healthy intestine, then you develop deficiency. Even if you are taking good food, still develop disease. The food goes from the intestine to the liver. What does the liver do to the food? The liver detoxifies the food. The liver is like this, and the food is coming in from the intestine. The protein, the carbohydrate, the fat, the vitamins, the water, the mineral, and the oxygen, all coming in. But some chemical could be in the food. You might have consumed DDT. You might have consumed alcohol. You might have taken some drugs. You might have taken food additives. So God put something in the liver to help us. All the food has to go through the main street through downtown. In downtown, there are stores in the main street, several of them, right there. Inside the store, there are guys sitting right here. Those guys are called the security guards. These cells called Kupfer cells, K-U-P-F-E-R. They put their hands out like this, all of them, and whenever they feel there is a chemical passing by, yellow, they grab it, and they put it in the alley behind them, behind the store, where the garbage man has to take it out and put it in a big garbage container called a gallbladder, and it comes out of the body. Even the garbage, which is a gallbladder, have things in it to help absorb the fat which is coming in later on. It's a very wonderful physiological system. No man can duplicate that, ever, how the human body works. Then the food goes where to? Where does the food go from the liver? To where? That's food with good protein, carbohydrate, and fat, and vitamins, and water, and minerals, and missing what? Oxygen. You don't eat oxygen, of course. Did I put it here? Yeah, I did. That's a mistake. Then it goes from here. It travels north right there and enter where? The heart. Enter the right side of the heart, and the right side of the heart, all it has to do, push it where? To where? To the lungs, to get what? To get oxygen. So the right side of the heart, it does not have to be very big or powerful, right? It's a small container. The right heart is almost unnecessary. It is necessary, but we can do without it. The left heart makes the right heart work. The right heart cannot make the left heart work. When the oxygen comes in, it comes like this to the left heart. Then the left heart is going to push the good stuff, which is what? Protein, carbohydrate, and fat, vitamins, water, mineral, and oxygen to where? To the rest of what? Rest of the body. So this pump right here becomes extremely important in health. You can take good food, you can absorb it. If the heart cannot pump it out, forget it. Are you following me or no? And if we have 1.5 million people die from heart disease, most likely we're going to have a problem. If it is not in the diet, it's going to be in the heart. And the heart does not have to show you any symptoms whatsoever. You could be walking, playing baseball, or jogging and drop dead. The heart doesn't show you symptoms unless it's too late. Heart never shows symptoms in early stage. Never. Because the heart itself is a self-independent organ. You can take it out of the body, put it in front of you, start the beating by itself. You can take that heart and we put it in a big container and give it vitamins and protein and tissue, and that heart can go for 100 years beating in the tube in front of us, in the container. It's a mystery, and to us physicians until now, how did God create the heart? We know the rest of the body, but we don't know the heart. Because the tissue of the heart is very similar to amoeba, the pacemaker. Well, amoeba is not a human tissue. The pacemaker of the heart is actually primitive amoeba tissue. It's not a human tissue. And this is why it generates its own electricity all the time without depending on the rest of the body. You know, amoeba is a single cell. It can do its own life. And this is what we see. The main cause, actually, of diseases start right here in the pacemaker of the heart. The sinus node, which generates what? Electricity all the time. And when it fails to generate electricity, the heart does not contract. And patients who are absolutely healthy, we did the heart monitor on them, 3 days monitoring. You heard about heart monitors, lots of you. And it used to be 24 hours. Now it's 72 hours. I was the first one in the country actually to introduce the 3 days monitoring system. And now we succeeded actually of having 30 days or 70 days or 90 days monitoring in certain patients. Not everyone needs that, but some people have a problem, and we both monitor for 3 days, and they don't have any symptom in those 3 days, and then the fourth day when they take the monitor off, the symptoms occur. And we miss it. So now the big companies, computer companies, develop this new monitor that it can go on and on and on, and you can take shower with, you can do anything with. It has own computer, everything is small like this. It only costs $30,000, which we have only one right now. The blood leaves the heart. What is the pressure inside the heart when it pumps blood out of it? What is the pressure, you think? 120 over 80. What's the word 120 mean? Anybody here knows? Yeah, what's 120 figure mean? That's how many pounds of pressure exerted on a square inch of the heart. Pressure exerted. That's a lot of pressure. This tube right here called what? What do we call the tube receives the blood from the heart? Aorta. How big is the aorta? About, let's say, 1 inch. 1 inch tube is going to take 500 cc of blood in less than 1/100th of a second, coming all of a sudden, on a pressure of 120 pounds per square inch. What do you expect the aorta to be then? Very strong, that's for sure, but it should be also what? Elastic. Because the aorta should bulge like this. When it gets that blood, should bulge and gets big, 3 inches, and then contract and push the blood down, and it gets big and small like this. You see? That's how the blood travels in the aorta. In pulses, and you can feel it here, that's what we call the pulse. Because the blood bulges and comes, so you have many small hearts. Each segment of the aorta is a heart. So we have blood coming out of the heart, and the aorta have millions of hearts, each one move it forward. When we analyze people's arteries, we discovered another problem. We already passed the heart. Tremendous problems in the heart. We don't have time to speak about it today. But when I looked inside the arteries, we find out that the cells of those arteries have a chemical in them accumulated, which made the artery very hard. What is the word hard in Latin called? What's the word hard in Latin? Sclerosis. So we call the disease arteriosclerosis, hardening of the artery. But if this has happened to be, and this has been happening right here to everybody, and this deposits right here, which is made of calcium, certain calcium, not the calcium you take in diet, some cholesterol, some triglycerides, some debris, some old germs, some dead germs, and all of that accumulates and builds a big deposit right here and make the artery smaller. So the amount of blood leaving the heart going to the rest of the body, what happened to it? It increases or decreases? Decrease. When the amount of blood leaving the heart decreases, what happens to the organs? They develop what? Disease. Could be any disease. Let's take one organ at a time. The brain doesn't get enough blood. So what we have? Problems in the brain, like what? Stroke, another example. Alzheimer's disease, another example. Poor vision, another. Cataract, imbalance, ringing in the ears. All of these things. If this poor circulation or less blood going to the legs, so what's happening in the legs? Cold most of the time. Achy, cramping. And the hands the same way. If this less blood going to the liver, less blood to the liver makes the liver cannot detoxify very well, and the person will get sicker. If this is less blood to the sexual organs, men or women both, it will create impotency, it will create many sexual problems. these problems which I'm talking about right now are all related to each other. One of them starts, the food itself is poor. The second, what? Absorption is poor. The third is what? The circulation, the heart is poor, and then the circulation is poor. So anybody can tell you, you're going to cure any disease by one single answer. Tell them you don't know what you're talking about. Anybody tell you, take this herb, this vitamin, this weed, this is going to cure that problem, baloney. Human body does not work that way. There is no single nutrient going to cure a disease. You follow me or not? It's going to take multi-effort. Good food, good diet, proper food, proper exercise, less chemicals, good absorption, good liver, good heart, no arteriosclerosis, then you have health. But some people, they said, I'm eating the right stuff, salads and everything, and don't take food supplements. They fool in nothing but themselves. People take food supplements, but their intestine is not working properly, and they have to take laxative and laxative. Those people's intestine, that's most of the supplement goes in and out. People who are taking good supplements, their intestine are good, but drink so much alcohol, which affects the liver. Also is bad. People who have all of this, but having hardening of the arteries in the heart, also it doesn't matter. You have to have one step helps the other, until it goes finally to the cell. If this problem happens in the nerves in the brain, if you take a nerve like this, and the nerves are important to us, and we find the nerves have dust in it, chemicals, dark toxins, deposits. So the nerve also hard, and the word hard called what? And then because we cannot give it any other name, we call it multiple sclerosis or MS. These diseases then related to many things. This is why when patients come to us, it takes us sometimes a month or two before we reach a diagnosis. And some people get mad. Come on, I used to go to my doctor, he said, open your mouth and say, he told me take this and go home, in 5 minutes. And here you have this, because unless you check every organ in the body, how they're functioning, you be guessing. And many people will find a very healthy body and blockage right here to the brain. Then we have to open the blockage to get the food to the brain. You follow me or no? Many people will find very healthy body, but they have a valve in the heart that sticks. We have to correct to that valve so more blood goes to the brain. Some people have excellent everything, but they had an infection when they were young, and the infection affected the heart, called rheumatic fever. And that has to be taken care of before that person going to notice any results. This is how complicated medicine and nutrition is. And people who can take shortcuts in medicine or nutrition, eventually the patient suffers in the end. We're not saying even with that we're going to be successful 100%. The only person knows the body inside is God. I don't know anything. With all my knowledge, with all 22 years experience in university, I still puzzle how certain things work inside the body. So we have to stop diagnosing people by looking at them from outside. When you go to a doctor, he does a cardiogram, EKG. Does EKG tell you, what does EKG tell you? You heard, everybody here heard about cardiogram, right? You lay on the table, they put the electrode, they give you a cardiogram. And he said your heart is good. That's a lie. Because the only way you're going to find about the heart circulation is good or not, get that person from laying down, have him run and check him when he's running, called the stress test. So we see lots of people. Mayo Clinic told them, your heart pilot from United Airlines. The clinic told them, you're fine. They came to us, they didn't believe it because they feel something, I guess. We check them, we say they have sudden death syndrome. They can drop dead in a minute. So I told that patient, I'm going to cure it for you with medication and other things and nutrition, but please don't fly over my house for the next 6 months. Anyway, all these organs in the body, the same thing applies to them. One organ, very, very important, called the immune system. The immune system probably, and the circulation, the two most responsible for problems among all of us. I have not seen a patient yet who have a good circulation and good immune system who's not curable from any disease. The immune system works like that. When you look at the human body like this, you find in certain locations of the body there are glands. Glands right here, you feel them, and glands inside the mouth, also called the tonsils, on both sides. You find glands in the neck. You find glands under the armpits, especially in women. You find glands in the groin right here. And if we open the body inside the bowel, we find millions of glands inside. These are called the lymph glands. All these glands are located in area that the immune system is important. If you have infection that enters through the ureter inside the bladder, this infection can enter the bloodstream and kill the person. So these glands are right here for protection. If you breathe air that it had germs in it, virus, influenza, cold, flu, immediately these glands swell up to protect you against that germ. If you eat food with germs or chemicals, those glands right here protect you against that. So this group right here protects you against allergy. This group right here protects you against sore throat and common cold infection. This group right here protects you against urine infection and bowel infection. And so every part, even the skin, has some of those glands. The failure of one of these glands to work creates disease. You follow me or no? In this case, loss of urine, infection, vaginal infection, prostate infection, rectum infection, colon infection is in this area. Here, if immune system is not working properly, we have lots of allergies, lots of infections from candida, from yeast, from bacteria, from anything. Is the answer is to kill the germs, or the answer to make the body strong so you don't kill these germs? Which way should be? You have to make the body strong. Anybody going to the bend and just killing infections, he's going to be killed by the same drug is going to kill that infection eventually. I'm not saying you do not kill infections all the time. I mean, if the infection is so bad in the throat, you have to take something for it. If the bladder infection is so bad, you have to help the body with taking some antibiotics. but you should learn that there are other means of helping the immune system. People who have these problems, frequent sore throats, frequent allergies, frequent intestinal problems, frequent infections in general, they have autoimmune disease or immune problem. How about AIDS? What is AIDS? AIDS is a virus that invades the body. We don't know how it got invented. Viruses always come new. New viruses come every year. You know, influenza virus, flu virus, always new kind of flu coming every few years. This new virus happened to be more common in homosexuals. We don't know why. We don't know who started it. Either homosexuals started it, or the homosexuals have poorer immune system themselves, some of them, that they exhibit the disease more than other people. We don't know. The fact is being exaggerated more than actually it is worth. Because if we're not going to die from AIDS virus, there are millions of other viruses killing us anyway. Hepatitis, meningitis, everything else is there. You understand? So let's get to the root of problems. The root of the problem is the immune system. Can you develop cancer if you have a healthy immune system? You can't. Can you develop severe infection if you have a healthy immune system? The answer is no, you can't. Immune system is there to defend you. Can you die if you have good immune system from chemicals? The answer is yes. If you take cyanide in Kool-Aid or Tylenol, it doesn't matter how healthy your immune system, there are always those chemicals that's so powerful that the body cannot tolerate. So there are limits to everything. You can have the healthiest immune system, you still have salmonella, typhoid, malaria, and cholera. So there are those germs, group of germs, they're too powerful for us. And those germs, we have drugs for them to kill them if they come to us. So drugs are useful when they are used in the proper place. How does the immune system work? And if you understand that, then you understand how you explain allergy, infection, and cancer, and everything else. When a germ enters the body, a germ looks like that, have legs and two mustaches. If it enters through your throat, this is a strep infection, or bacteria in the bladder, or gastroenteritis in the intestine. They all look like that. Some of them have mustaches. Some of them have thousands of mustaches. Some of them have thousands of legs. Some of them have legs. The yeast, it looks like this. And have arms like this. The virus looks like this. The influenza virus. The AIDS virus. The other viruses. So they all have different shapes and forms. A chemical like hay fever, when you inhale something that irritates your system, it looks like this. When all of these things enter the body can identify them. Second time, not first time. Sometimes these things do not come from outside the body. Sometimes they are produced inside the body. You have an organ like say the aorta, very rarely, and one of the cells starts multiplying. We call that what? Cancer. The cancer cells get loose. The cancer cell looks like this. That's how the cancer cell looks, where normal cell looks like this. Has a bigger nucleus, is ready to explode. It is understandable for anybody who have anything up here that if we are faced with all of these things since Adam and Eve until now, human beings and animals have to have outstanding immune system to defend them. We survived all of these dangers from the past, survived animals, survived hurricanes, survived tornadoes, survived infections, epidemics, cholera, everything, because we have a good immune system. Very well developed in human beings. It is not as good developed in human beings as animals. Like monkeys will have a better immune system. Worms in the earth will have much better immune system. Amoeba will have much more sophisticated immune system. The smaller the organism, the better the immune system gets to protect them from the predators and everything, so the species and life continue on Earth. When all of these enter, what happens? There are cells swimming in the bloodstream. And those cells, they have binoculars like this, and they're holding on it, and they use the binocular to look to see what's going on. Once they see something looks strange, they have a small telephone. Then they call a big gland called the second defense center next to them. They tell him, listen, I just saw something red with one eye, two mustaches, and 6 legs, and moving in certain direction. Not only that, listen to this. They put their tongue out and taste them, and it tastes terrible. And they have their nose comes out and smell them, and it smells like that. And that is true. If you look, these are the white blood cells. If you look under the microscope, you have white blood cells, and just drop a piece of anything there, bacteria, or a chemical, or a cancer cell, you see those guys moving around, and they surround that thing, and they touch and go, and they keep feeling. This is called communication, to understand the chemical reaction. What they try to do is analyze this 100% fully, give the information to this second center right here. Why is that? Because these guys here, their life only 8 hours. White blood cells, they live for 8 hours and they die. What kills them? These guys gonna kill them. Once they just get the information there, what will happen? They tell the center, now we give you the message. We're gonna take our hands together, get few of our brothers surround them, and put hands and close the area. And they start opening their mouth and eating these things. And they swallow them. They put everything and they die. After they swallow them, they die. Sometimes the germ is much smarter. Because germs also are cells, they have their own immune system. And they also have to survive. So what they do, some of them have a capsule right here full of poison. And they explode the poison and kill all of them in one shot. Some of them multiply new babies very fast. Because they know this guy's going to eat them, so they make about 1,000 babies per second. I said, okay, you can come and eat, we're going to make more babies. This is what happens when you develop pus in your hand, like abscess. You have a small pimple, it gets bigger and bigger and bigger because the germ keeps multiplying very fast until it opens, and then you get rid of it. Once all of this information identified, you're still sitting right here, this thing is happening right now inside your body, then the germ will succeed of killing all of these? Very rarely that happens. Every minute you kill them. But sometimes, like cancer cells could be too strong, and the germ moves ahead in the bloodstream. Like that. It hits the lymph node in front of it. The lymph node have a very sophisticated system. It's already got the information in it. So what it does, it releases nails like this. And then releases a guy like this with a hammer in his hand to hit the nail. And then once the bacteria passes by or the cancer, they stick the nails and they bang them inside and they break that cell apart. This, again, called complement fixation system. It's a part of how the immune system develops, and this is what we call interferon. You heard about interferon, the substance fights cancer. Interferon is made in the body. You don't just get interferon. It is true you can buy interferon. The best source of interferon comes from monkeys. And you have to kill, for a cancer patient, 1,000 monkeys per day to give him life for 1 day. And I just don't see that. Any reason to kill 1,000 to keep a guy 1 day, well, that's ridiculous. So we find out the best way to get the interferon to function properly, go back to the same old thing. Right here. It needs good nutrition, less chemicals, and less stress to make the interferon work. So people under lots of stress can develop autoimmune disease. People with multiple sclerosis, they don't tolerate stress. Because stress gets rid of whatever left of the interferon, and they are open. The body is open to all kinds of problems. People consume chemicals, people who have poor nutrition all develop problems. AID, autoimmune disease, is not AIDS. AIDS just happens to be a new word. But AIDS, all the diseases that your immune system is not working properly, is called immune deficiency. What does the word auto mean then? When the immune system fails and the bacteria advances in the body, or the cancer cell, or any chemical, or candida, or yeast advance inside the body, then the body starts forming antibodies against it. The antibody also attacks the body itself. So the body is making antibodies, are you following me or not, to kill that germ, but in the meantime it's killing its own self. So those antibodies start eating in the joints and cause a disease called what? Rheumatoid arthritis. Start eating in the nerves and cause a disease called multiple sclerosis, or Parkinson, or Alzheimer's disease, and so on, a rheumatic fever in the heart, glomerulonephritis in the kidney, and so on, every organ. Lupus in the skin, and you can name lots of diseases coming every day, autoimmune disease. And when we go to autoimmune disease right now, how many of you know patients or somebody with autoimmune disease? Everyone here knows somebody who has that kind of a disease. What does the doctor do when you have a disease, autoimmune disease? MS, Alzheimer's, all of these diseases. What does he do? The only thing we know of medically is to stimulate the adrenal gland by giving ACTH, which they don't do, which is okay for a short period of time, or the easiest way is to give cortisone, and you know anything gonna respond to cortisone. Because cortisone is an adrenal extract. It doesn't matter almost what infection, if you give cortisone or what's a problem, the body is gonna feel good with the cortisone. But only for 2, 3, 4 months. After that, you have side effects of the cortisone itself. Yes. Backup.
At what point do antibody functions become distorted?
What? Say that again.
The antibody begins to
Attack the body. Once the infection or the problem or the yeast or the chemical or the poison or whatever have passed the lymph gland system into the body, your problem is a battlefield in the bloodstream already itself. The battlefield is open and the body starts making antibodies against the germ or against the chemical of the germ or against the allergic substance, and that substance, then the antibody might attack the body itself. So if it attacks the skin, you have red blotches called lupus. If it attacks the joints, then we have swelling called rheumatoid arthritis. If it attacks the nerve, then we have the numbness and weakness and tiredness called multiple sclerosis. If it attacks the butt cell in the center of the brain right here inside, we have Alzheimer's disease, and so on. These autoimmune disease antibodies are very dangerous. So we give cortisone to try to slow them down, which is good. If you have really severe allergic reaction, cortisone works. Severe asthma, cortisone works. Severe swelling in your skin, cortisone works. But up to certain limit. But cortisone is getting rid of only symptoms, not the cause of the disease. Then I went ahead and then tried for the last 4 years in practice researching that field. We have succeeded almost 99% with heart patients. As a matter of fact, I have patients right here in this room. One of my first patients I saw have malignant heart problems. It means the irregular heartbeat tremendous, and was the first time we documented that nutrition and certain IV actually cured the problem. And that was a shock to me. Then we find out with a different IV, the blood sugar in diabetic patients have gone down, some of them from 1,000 to 100, and 2 or 3 units of insulin rather than 100 units of insulin. So we have seen lots of results in every disease, except cancer. That's up to last year now. Except cancer, rheumatoid arthritis, multiple sclerosis, and all the autoimmune disease group. Because nutrition is no longer working in autoimmune disease as probably as it should. Because the knowledge, once the body starts mutating, producing new kind of antibodies, new things, the information is no longer controlled by the vitamin or nutrition or the protein or that. It's controlled by the cells of the body. The genes itself is giving the messages, and we have to get rid of these messages, take them out, and put new messages in. So far, what we have been doing for these people, we still give them good diet, get rid of the stress, detoxify the body, and we give them hyperalimentation, which is protein, certain proteins, pre-digested directly in the bloodstream. Give them a globulin, which, globulin is an antibody. It fights back. Give them trace minerals, lots of vitamins intravenously. And this is all was experimental a year ago. This formula in front of you right here, it cost us last year $200 to make one bottle. And the patient, some of them need it every day, some of them needed it twice a week, some needed it once a week, and the insurance company said, no, we're not going to pay for it. It's experimental. But what you're going to do to a person who's actually dying? Cancer patients, allergic patients, multiple sclerosis patients. We got to do something. We just can't. I don't think I have the right to tell a patient go home and die. You know, I think there's always something. Maybe I don't know, but there is always something. Then, right now, most of insurance start paying after we have already proved that it works. But the companies who make in the IV have tried to increase the price to $1,000 a bottle, which they cannot succeed because we won some kind of decision against them that they have to give it with that price for at least one more year. The hospitals start using it also. This is not like chelation that is so much anti that. This is something very highly scientific, and any immunologist or oncologist or allergist who have studied should understand this is the only way to go, not allergy shots, not cortisone, not any of that stuff. So when we give that to patients with autoimmune disease, some of them responded faster than others. For example, patients with Alzheimer's responded the least. So there's probably other factors I don't know about yet. Patients with allergy responded 100%, food allergy. They all were able, after 3 months, to eat anything they want. We used to do allergy tests, allergy blood tests, which cost quite a bit of money. As you know, some of you have done the test, $200-300. We send it out. We don't have to do allergy tests, because unless the patient really so paranoid and say, oh, I want to know exactly and all of that stuff, we do it, but it doesn't mean anything. So what, you're allergic to 30 different kinds of food this year. Next year you'll be allergic to 60. The year after you'll be allergic to 200 foods. So eventually you're not going to find any food you're not allergic to. So don't keep doing the test. The main thing, get to the root of the problem, introduce the immune system to the food. So what we do, we give them the IVs, give them medication to slow the reaction down, have them go back to the food they're allergic to in a smaller quantity until it increases. And then after about, most of patients 3 to 6 months, they're cured. They eat anything they want. I tell them, when we begin the program, I want you to eat McDonald's. And if you can tolerate that, you can tolerate anything. You're not allergic anymore. This is as bad as you can get. You know, food with high saturated fat, lots of chemicals, lots of salt, lots of that. A healthy body should tolerate that very well with no problem, right? But people who have intestinal problem, we test them with that. And after they said, I ate it, I said, you go home then. You're fine, you're cured. I'm going to take some questions right now, and let me see if I have discussed everything or not. That's basically all I'm going to speak about. I'm going to give my telephone number at the office, 312-395 356. Come on, 9009. Talking about Alzheimer's. I have a farm. I have some horses. I enjoy being with them, and I just came from there, and that was the number 395 I was going to write down because I just came from there. 356-9009 from 10 to 5. Dr. Percy or Dr. Ruby are the one who answer the messages for you, any question you want to know. I'm going to take some questions right now related to autoimmune disease only. Start with this group right here and then come right here. Anybody in the front? Second row. That's good. Either you know something or you haven't learned anything. Yes, ma'am. Retinitis pigmentosa is a disease, autoimmune disease again, that the immune system affects the retina. Most likely beta-carotene is not going to help that. But beta-carotene is a derivative related to vitamin A. It should help the eye in general. What other choice these people have? They're going to get blind anyway. So we go ahead, we have to give them everything we can. I have a patient with retinitis pigmentosa that they almost got cured, improved it tremendously, given them the proper diet, and just lots of vitamin C intravenously. Nothing else. This is 5 years ago. That's all I can get in the market, vitamin C to put in IV. Now there are more things we can add in IV. But those times, the only thing was available was vitamin C. So we get 30,000 milligrams every day, and it responded. So you can't say yes, you can't say no. I look at it this way. Anything natural you can take that is not expensive and that doesn't have side effects, you can take for any disease. Can placebo effect be beneficial to the human body? You know what the word placebo means? Taking something thinking is going to help you. Is it good or bad for us to do that? It's outstanding, actually. There's nothing wrong. If you want to give me something, say, Dr. Ness, I made this magic soup right here. It's going to give you energy. I will drink it. I know it's placebo, but if it makes me feel good, that's all I care for. Mayo Clinic have done study on that. That's answer to your question, can this? Yes, everything is can. Don't ever say no. Mayo Clinic does work on that. They find out when people are happy, their interferon is very high. When people are so negative and sad, their interferon is so low. They took blood from a person who have high interferon, who's happy, put it inside the other person's blood who is sad, and the sad person became happy. So happiness and depression is no longer related to here. That's all organically related, something wrong in the body. So the answer is yes. Yes?
Beta-carotene in regards to diabetics. Now, I understand diabetics cannot assimilate vitamin A.
Who said that?
Well, I heard it. I don't know who said it.
You heard it wrong. Because there is no way anybody can live unless they can assimilate every single mineral, every single vitamin. You can live more than a year. Diabetic assimilates everything. Diabetic is not a bad disease. Diabetic, the only person gets in trouble with diabetes are the diabetic patients who let their blood sugar go above 300 for a period of 2 to 3 months. On and off, keep going up. Any blood sugar above 200 converts to alcohol called sorbitol. That alcohol in diabetic patients swims in the blood, enters the cell, and causes the blockages. So the problem in diabetic patients is blockages in small arteries. That's all the problem is. There's no other problem.
Then what I said is unfounded completely.
Absolutely unfounded, because a diabetic patient, if they have the blood sugar under control, nutritionally or by insulin or by medication, doesn't matter. They should never have a problem all their life.
Okay, then does beta-carotene, would that help with that?
I don't know why we selected beta-carotene tonight to talk about. Vitamin E and vitamin C and vitamin B are the most important nutrients. Calcium, magnesium, zinc, and trace mineral are the second most important nutrients. EPA and beta-carotene come in the last category. So let us get things according to priorities. You know, beta-carotene is related to vitamin A. You get it in lettuce. You get it in carrots. You get it in lots of things, but you don't get vitamin C, B, and E in everything. So this has become a mandatory supplement, where beta-carotene, it does not have to be mandatory supplement. The other food supplements, B, C, E, minerals, alpha, all of this, vitalia, all of that, can be mandatory. The others can be reserved for certain diseases. Or somebody's not feeling good, take it and see what happens. If you don't see improvement when you add it to the diet, after 3, 4, 5, 6 months, then you have to think, am I absorbing my vitamins, period, or not? Because that's expensive if you take it and you don't absorb it. You know, the sewer department is rich with that. Yes?
My understanding was that diabetics had difficulty converting beta-carotene to vitamin A.
Absolutely not. Diabetic patients have absolutely normal liver. 100%. Beta-carotene to vitamin A. First of all, you have to realize this. You eat salad. The green chlorophyll splits in the liver to alpha and beta-carotene always. So anything green, it has alpha and beta-carotene. Anything yellow has always beta-carotene and vitamin A. So the conversion is not a problem. You got to remember, beta-carotene and vitamin A, one of the vitamins, they're not alive. This means you can cook it and cook it and cook it and nothing happened to it. Because it is the most important vitamin to the human body is vitamin A. This is why everything you see is green. Because there is absolutely, God will not allow deficiency of vitamin A to any creature. That's why you see lots of greens, because lots of vitamin A. The anti-disease group, the B, C, and E, are the one man-made deficiency. Any other questions right here? Okay, this is the last time I'm going to ask you this way. Right here, any questions? From the front to back. None. Yes.
What type of testing is done for malabsorption, and what are the symptoms?
You don't have to have symptoms at all. But when it is advanced, malabsorption could be lots of gas, diarrhea, constipation, intolerance to milk, intolerance to greasy food. It doesn't have to be always that. If you tell me I'm taking lots of vitamins and check the bloodstream and you don't have it, then it's not absorbed. So these are the tests. If you only want malabsorption. But if a person will develop malabsorption of nutrients, how long this been going on? Let's say 2-3 years. How many diseases already have been established in different parts of the body? So there is no escape, that everything has to be checked once and for all, and then repeated after the therapy finished to be sure it's been cured. And that's to avoid guessing. If one wants to guess, then it takes years to experiment with guessing, but the health, it deteriorates faster, and that is the main problem. Yes? Yes, ma'am. Calcium probably is the most important mineral. As a matter of fact, you heard about salt causes high blood pressure. Salt does not cause high blood pressure. It's the low calcium which mixes the salt cause high blood pressure. This means I have to have the guts to tell my high blood pressure patient, I want you to eat lots of calcium and lots of salt and zinc, which I did. And the blood pressure went down. So that is a false. Salt is extremely important to health. And there are more and more people I see with low salt in their body. Low salt can cause tremendous diseases in the human body. High salt doesn't cause much problems. You've got to get rid of this information you read in the National Enquirer and Prevention magazine, because the people who write these articles, they're not biochemists, they might not be MDs, they might not be physiologists. They call themselves nutritionists. And anybody can call himself a nutritionist. Nutritionist is not a degree. You can just write, I'm a nutritionist. What does this mean? Tell you how to eat. Every housewife is a nutritionist. She raised all these kids. She has to be a nutritionist. Yes, sir. We're located in Lake Bella, Illinois. Some place you're not going to find it in the map. You take 83 south, about so many miles, I think. How many miles is it? 60? That's what I thought it was 100. About 60. It's 170 is Grand Avenue, 132, and 83 in the corner there. South of Antioch. In the corner is a gas station. It's not a gas station. It's next to it. Oh, yeah. About 5 miles, 8 miles, something like that. What do you want to know? What you like? It's a building. No. I beg your pardon? Oh yes. No, not hospitalization. This is not a hospital. It depends on the policy. This work is done as outpatient. If your policies cover you for outpatient diagnostic testing, it will cover it. If the policy cover you under a therapy for existing disease as outpatient, it will cover. Most of the insurance companies didn't used to like to do that. They used to like in-hospital better, but they're switching right now to prefer outpatient treatments than hospitalization. We have admitted 4 patients to a hospital in 5 years. Okay, that's all. And we find it unnecessary in many cases to do that. There is no single myocardial infarction. There is no single cancer developed, which was not there before. So it really, in the first 4 years, it was 3 years actually, it was very difficult convincing insurance company that preventive medicine is the best way to go. Right now, we're getting lots of good comments, lots of cooperation by all the insurance companies, except Medicare and Blue Cross Blue Shield. There are 2 insurance companies, they still do not understand the role of preventive medicine yet. And I don't think they ever will. The clinic is just like any large doctor office. We do the blood test, we send it out, and we do all the cardiac testing there, nuclear scanning and x-rays, administer the IVs there, and this is not a clinic owned by one person. There are, all this machinery, which millions of dollars, owned by banks and investors and things like that to put it in this clinic. Does that answer your question? No, you're not going to get with me later. I don't have time. You talk to Dr. Percy or my secretary. Yes?
What do you think about the fact that half of the dental filling is made of mercury?
Made of what? Well, mercury is a dangerous disease, should not have been done made of mercury. And mercury causes nervous problem, central nervous and peripheral nervous system disease, and it can be dangerous. It should be taken out and a different filling put in. And the amount of mercury has accumulated in the body, it does not leave the body. It stays there for good. Then use gold. I'm sure, huh? No, I don't think so. Well, I really don't. I don't have any cavities, so I cannot tell you about that. But I would think you have to ask your dentist or the dental society about what's the safest thing. Yes, ma'am.
What is your opinion of hair analysis in determining
We used to do lots of hair analysis. And hair analysis is excellent tool to tell you the toxicity you have been exposed to in the past. It does not tell you anything about nutritional program or nutritional deficiency at all. And the report you get sometimes from hair analysis clinics, it tells you your low calcium, high sodium, and all of that is wrong. The only thing right in hair analysis is if you shows lead, arsenic, mercury, strontium, all of these radioactive materials, then it is right. It tells you about previous exposure, not recent exposure. However, most of insurance companies do not recognize hair analysis yet. And that because the ignorance they have about analysis. They accept blood analysis. Blood analysis tells you what? What does blood analysis tell you about toxicity? Anybody here knows? When was the toxicity enter the body? Is it 2 years ago or yesterday? Right now. And you want to know the past, so you cannot really depend on the blood analysis they request. Then the second alternative is tissue biopsy. Piece of the liver, piece of the kidney, and we analyze it for lead. We're not going to do that, so we go to the hair easier. They don't accept the hair, they want the blood. And now, thanks God, they finally say that actually any amount of lead in the body is abnormal. They used to say you should have a normal lead. You know, if you have toxicity from that number to that number, that's normal, above that's abnormal. There is nothing normal about toxicity. They're all abnormal. So right now they start accepting that. As a matter of fact, Bethlehem Steel, one of the biggest today, we're doing hair analysis for all Bethlehem Steel employees. The company itself accepted hair analysis to protect their employees from lead. But the company pays that themselves, and they deal with their employees themselves. No insurance company doesn't do that. Yes.
another question is, okay, so you find out in your body the toxic level, then you were saying that the body holds on to these metals and can't get rid of them. Can't you get rid of them if you're taking the right thing?
Once a heavy metal enters the body, it's there to stay. The only way you remove it is a chelating agent intravenously, such as EDTA or penicillamine. Penicillamine removes the copper, and EDTA removes lead, arsenic, and mercury, and some of the radioactive substance. And plus, it combined with the calcium in the deposits in the artery, it does help arteriosclerotic patients. No, fasting does not eliminate that. Fasting gets rid of fat deposits, makes you lose weight, gets rid of water, but it does not detoxify the body like we used to think. So colonics doesn't detoxify the body, enemas doesn't detoxify the body. Oral chelation, there is no such thing to detoxify the body. It's misnomer. There is no such thing. Any herb you take, it does not detoxify the intestine. Herblax does not detoxify the intestine. It removes the stool, which have chemicals in it. If it stays, it can cause problems. But to remove a toxin, the toxins in the human body are divided to two kinds: the life and the dead. The life toxin, yes, vitamin C and E and B and all of that can protect you against that. But the dead toxin that's already precipitated inside the organs, like glass, nothing will dissolve it, except a chemical amino acid called EDTA that it have a chance to do that. Thank you very much. You have a good night.